Social Services, and Dr. Felix Cabrera with the Physicians Advisory Group. And now to Governor Leon Guerrero for her opening remarks.
Thank you, Janella. Over the past week, we tested 1,707 individuals and confirmed 48 new cases of COVID-19, which results in a 2.75 positivity rate. This increase was to be expected because we increased our testing capacity. In total, we tested 12,147 individuals, which translates to a 7.4% of Guam's population. This places us ahead of states and territories like Hawaii, Pennsylvania, Texas, Washington, Puerto Rico, and the U.S. Virgin Islands. To date, Guam has 248 cases with 5 deaths. 179 cases have been released from isolation and 64 active cases. One of these cases was identified through contact tracing. No other cases reported contact to a confirmed case. Contact tracing is ongoing, and we will release information relating to these cases once it becomes available. This increase in the number of confirmed cases is very concerning, and it should be taken, and we are taking it very seriously. As I have said before, our decisions will be based on data, not fear. As Dr. Felix Cabrera will explain, our decision-making is based on a combination of data-driven metrics. These include test positivity rate over a 7-day rolling average, our ability to robustly conduct contact tracing, and our census of hospitalized COVID patients. While an upward climb in test positivity rate has given us pause, the data Dr. Cabrera will present indicates that our progress is not lost. We will not roll back any of our current measures. However, we will be delaying any further relaxation of restrictions so we can observe the data. And after meeting with the state surgeon cell, I have decided to delay the reopening of Guam's tourism industry. We have not decided when, nor have we set a goal date, which will allow us to monitor our numbers. Yesterday's case positives was a good sign, but decisions are not based on any single data point. Due to the recent increased COVID-19 cases, not just in Guam, but across the world, we are making changes to the quarantine, testing, and monitoring requirements for all travelers entering Guam. Dr. Cabrera is here today and will be explaining these changes in more detail. The changes will be effective after midnight on Wednesday, July 1st, 2020. The Department of Public Health and Social Services continues their investigations and efforts in our COVID-19 response. As you are aware, Linda DeNorsi will retire from government service on July 3rd. For more than 3 decades, Linda has served the people of Guam. She has been committed, she's extremely competent and dedicated to the health of our people. COVID-19 has forced each of us to hold even closer to those we love. Her sense of urgency, her experience, and her successes have benefited not just her agency, but the community as a whole. She will be missed, and we greatly appreciate her service. Lori Duenas is serving as Acting Director of Public Health, and I am very confident in her leadership and in the leadership of Deputy Director Josie O'Malley, a veteran of Public Health's Bureau of Communicable Disease Control. In the days and weeks ahead, we are all reminded that our struggle against COVID-19 is far from over, but we will prevail. While businesses have reopened and social gatherings of no more than 25 are permitted, New cases are a reminder that the world is not yet COVID-free. My message to the people of Guam is simple. Though we must remain physically distant, we are closer than we have ever been. This means we cannot become complacent. Limit contact to those within your households. Wear your face mask. Practice social distancing of at least 6 feet. And please wash your hands. Without a vaccine, this is how we can beat COVID-19. There may be tough days ahead, but we will get through this together. I'd like to ask Lori Duenas now to give us an update on the COVID-19 status. Lori?
Thank you, Governor. To date, we have 248 cases. Of that, we have positive. There were 1,652 that were totally tested. 5 became positive during that testing, and 1,633 were negative. We noticed that there is an increase in the north, and that's where we're going to be doing in the next 3 weeks. We're going to be having outreaches that is going to focus in the north side. Of the 363 that were tested yesterday, or the 25th, we have 1 positive, 2 were follow-up, and 316 negative. We are continuing to run the tests that have come in, and we will let the community aware of the results as they come out. For the positive, we have already informed the mayors so that they could be aware of the numbers of positive cases in their villages. Governor, I believe that's all. Thank you.
Thank you, Lori.
Thank you. And now I'll turn it over to Dr. Cabrera for his presentation.
Thank you, Governor. Okay, so what I'll be sharing with everyone today is a breakdown of the update on Guam's COVID-19 cases in graph form and introduction of new quarantine, testing, and monitoring requirements for travelers entering Guam. So just to summarize again for everyone, that new case counts tell us the incidence of active disease and active cases on Guam, while test positivity rates tell us how wide of a net we are casting to identify active cases. Our goal ultimately is to keep both as low as possible. So on this graph here, we have COVID-19 new cases and test positivity rates on Guam for the month of June up to present. So on the left side here, you can see the new cases, and now we're using a 7-day rolling average as opposed to previously we're looking at 5-day rolling averages. The reason being that this is more representative of more data that we can see how trends are going overall, and it's also the way that most of the world is looking at their data. So new cases on axis on the left, test positivity rate axis on the right. On the red is the new cases. As you can see, it's gone up, and after June 20th, we've seen a spike up in both new cases and test positivity rate. What we had previously said as a threshold of concern is if we start having more than 5 new cases per day or a test positivity rate above 3%. And as you can see, over the past week, we've gone above that threshold. So therefore, we are concerned, and has allowed us to take a deeper look into our data and also into the policies that are set by them. So this slide here takes a look at our testing capacity overall in relation to the new cases per day. And it's a complicated slide, but the summary is basically that if you see this green shaded area, that's good. That means that we're doing a good amount of testing per day overall. But the red side would be that we're not. And that's what it was earlier in the pandemic, and we've done better. And as you can see, we've gotten to a point where it's become much more slim and the area is much less. So it is a warning that the cases, if they continue to go up and if we're not doing enough testing, that that we be going backwards in terms of our progress. When we look at Guam's mobility in relationship to the new cases and the hospitalized, as you can see here in the blue line, that our mobility has been steadily increasing, and our case count here in green this time, you can see it jump up in this part of the graph, which is more recent. But the purples are hospitalization, and it has not gone up substantially. Right now, we have one patient that's admitted in Guam Memorial Hospital that is COVID positive, but we have not seen a significant spike, which is very reassuring, especially nothing compared to what it was early in the pandemic when we had quite a bit, up to about 25 patients at the peak. So that part is a additional reassurance, despite seeing an increase in number of cases and increased test positivity rate. If we were to zoom in a little bit closer into the days here, you can see, and I'm just pointing out here that June 8 was the day that we set in new quarantine and testing requirements with definition of hotspot areas. But since then, you can see our mobility continues to go up. The number of new cases did go up, almost a couple of weeks after the quarantine changes were made. But again, hospitalization stays low. So that being said, I'm going to move into discussing the new quarantine testing and monitoring requirements for travelers entering Guam. So as you may recall that this is our current process as it is right now, where we had identified international hotspot areas and criteria for quarantine, and then also for non-hotspot areas. This isn't going to be changing. And this is the new policy for travelers entering Guam. So due to the recent increase in COVID-19 cases on Guam and around the world, the following changes will be made to quarantine, testing, and monitoring requirements for all travelers entering Guam, effective after midnight on Wednesday, July 1, 2020. Hotspot locations will be renamed as high-risk areas. For the U.S., risk status will be determined by a state-by-state level on a state-by-state level to include territories. The default level of quarantine required upon entering on Guam is based on whether or not a traveler is coming from a high-risk area. A pre-arrival negative PCR test, in particular those traveling from a high-risk area, is necessary to determine the location of quarantine required and eligibility to qualify for an abbreviated quarantine length. Residency status will not determine the level of quarantine or testing required. Considerations for alternative quarantine locations will still be made in certain limited circumstances. High-risk locations will be determined by a calculated COVID-19 area risk score, which primarily assesses an area's recently calculated case doubling time and test positivity rate. So this flow diagram will allow someone to determine what are going to be their quarantine requirements and testing needs. So if you start out by asking, are you originating from a COVID-19 high-risk area? If you are not, then you automatically go into home self-quarantine. If you are coming from a high-risk area, then the next question is, do you have a negative PCR test within 72 hours prior to arrival on Guam? And if that answer is yes, you do have a negative test, then you can proceed to home/self-quarantine. If you don't have that, then you will be quarantined in a government facility. Now, so in either case, you are going to be quarantined. The question is just whether you be at home or will be at a government facility. So once you're in quarantine, those with a negative PCR test within 72 hours prior to arrival on Guam may opt to repeat the PCR test on day 7 of quarantine. Everyone else may opt to test on day 10. Again, this is an optional test to see if you may be eligible for an early release. If you do have that test and it ends up becoming negative, Then you have the early quarantine release, but you still must fully comply with the 14-day symptom monitoring and tracking. So that is key. So just because you get out on day 7 doesn't mean you're done completely. You still have to comply with this program for the full 14 days minimum. If you opt to not get a test to try and qualify for early release, then you would have to complete the full 14-day quarantine. And so the last remaining part of this would be to define which are these high-risk areas. And this here is the list now that we have discussed and have decided to list not just countries, as you were familiar from previous hotspot designations, but now we are included U.S. states that are high risk. These include Alabama, Arizona, Arkansas, California, Florida, Georgia, Idaho, Mississippi, Nevada, North Carolina, Oklahoma, Oregon, South Carolina, Tennessee, Texas, and Utah. High-risk Asian/Pacific countries will be Bangladesh, India, Indonesia, Nepal, and the Philippines. Other high-risk continents/areas, Africa, Central America, Middle East, and South America. And this concludes my slide presentation.
Thank you, Dr. Cabrera. And now we'll move on to, we'll open the floor for questions. We'll begin with the point, Nick Delgado.
Happy Governor. Happy everyone. I want to start by asking, Gov, you had mentioned in your opening remarks that you're not rolling back any of the restrictions moving forward despite the spike. But then we see some of the changes that have to be done, obviously, with the quarantine procedures for passengers. And so can you kind of speak to that and how that isn't a rollback?
So the quarantine changes is not a rollback. I think the quarantine changes is much more putting in measures that are much more applicable to current situations. And additionally, you know, we are following data, Nick. As I have always said, we're looking at 7-day rolling. And again, we're looking at test positivity and also doubling of cases. And we're also, in addition, looking at what is our capacity in hospitalization, what is our capacity in contact tracing, and what is our capacity in testing. And those are within what we feel are good capacities. Our positive cases are rising, and like any other history that you have looked back with the world or even in the United States, as you increase your testing capacity, which we have, we now, like I said, have tested over 12,000 people in our community, which gives us a penetration rate of about 7.4. We expect to see positive cases. Most of these positive cases are asymptomatic, and they have been identified through contact tracing. Additionally, we have also seen these positive cases as a result of our community outreach, which is what we really want to do. We really want to see that because we want to know what exactly is our community spread out there. So all the things that we're doing within proven methods and based on data and science. And so I'm very confident in what we're doing to continue on containing our coronavirus pandemic here.
Thank you, Governor. And for my follow-up question, as you just mentioned and reiterated there, a lot of the decisions that you guys are making are not based on the fear that we're hearing out there. It's more on the data, the scientific evidence. But as you can imagine, Gov, the spike, all of this that we've heard in the past couple of weeks has been a result of the airmen who, while they're still under investigation, violated those restrictive movement orders. And so with all the frustration around the community, do you feel in any way that you might have failed in containment efforts?
Absolutely not. I think the procedures and the systems that we have in place has actually protected our community, and we've looked at how we can prevent spread in there. My understanding and my information from public health is at this point in time with their contact tracing, there has not been a connection of the airmen and the positive cases that we have seen. However, they are continuing to, of course, investigate contact tracing. So the information and the data and the the investigation that we're seeing is not saying that those are as a result of airmen, which is also, I believe, a big concern to me, because that means it's out there in the community and it's not through clusters, which is very concerning. But I want to assure the public, Nick, that our program of contact tracing is ongoing. Our investigators are very experienced investigators. When we see a positive case, they go out and investigate those contacts of those positive cases and go forward in deciding whether to test them or not based on the information and based on the evidence that they see. So I want the public to be assured that we're working everything within our proven protocols and proven procedures to prevent and to isolate these cases so we can continue to protect our community.
Thank you.
Thank you, Nick. Next is I-94, Thomas Menglotnya.
Good day, everyone. Governor, I just wanted to shift to the public health response for the homeless population. The lieutenant governor, as well as your acting parks and recreation director, had indicated that they hoped that the contract or RFP would be awarded for the hardened homeless shelters by yesterday, Friday. What's the update for that? And was anything signed at the end of business day yesterday? And what seems to be the holdup now? Is there anything else you can tell us about the plans to build homes for the homeless across
Yes.
the 20 acres? This was something that former Governor Gutierrez mentioned when he visited homeless at Paseo.
Yes, so we are already have been identifying, there are two things here that we're looking for. One is a hardened structure for our homeless, and two is the services that we need to provide those individuals who will be sheltered the necessary kinds of services, social service, mental health, medical, and so forth. So on the service side, we have identified a agency that would do that. I don't know if it's already been signed, but it has already been identified. In terms of the facilities, this is the hardest part because it's very difficult for people to allow their structures to be the facility to house the homeless. And so we're not getting, a whole bunch of people that are coming to the table. So we have to be very innovative. And so we're looking at warehouse spaces. We're looking at maybe abandoned apartment places that we can renovate. We need to look at what is it that we can do immediately and temporarily. And there's been discussions about just getting a warehouse and putting tents in there. So there's been a lot of creative and innovative ideas to make this shelter happen. As far as funding and resources, there is the funding and resources that's not an issue. I think our biggest challenge is finding the hardened structure and a structure that would meet the guidelines of homelessness requirements and those requirements. Because initially, as you know, we were going to use the Paseo and put tents up, but that was not, that does not satisfy the requirements. And that's why we went to looking for hardened structures. And again, we're working all the options that we can get.
And for my follow-up and last question, we know that during this pandemic crisis, we've seen several resignations, retirements, and shakeups within the administration. For example, the Chief of Staff Tony Babata, Pilar Laguatnia, Bobby Alvarez, John Birch, Tom Atta, the Legal Counsel Hyun, Public Health Director Linda Pinco DeNorsi. We know, based on an internal memo, didn't give her 2 weeks notice of her retirement. Is there something more to this than folks being tired, stressed out, reflecting on life? Is there any truth to a federal investigation? Any possibility? Are you aware, or has any members of your administration, previous or current, been contacted by the feds in relation to any type of probe? And is Leslie Travis hired as your new legal counsel as well?
So, I think you put in there like 3 or 4 questions, and I've forgotten the first one, but I will try to answer as many as I think. First, there has been no federal probing. I don't know where that's coming from. All of these people that have resigned have not done anything in the form of any kind of violations of federal laws or local laws or any of that. So I just want to put that to rest, because there is no federal probe in this at all. These individuals are individuals that have given a lot of their years and their lives to public service. And so for personal reasons, some very dear to their heart, they have decided to retire. And I respect that. I respect that family for them is first, like any of us here. I honor and admire all the work that they have done within decades of years for public service. Others have, I have asked others to be reassigned to other places because I wanted to match their skills to what we need to do. For example, Bobby Alvarez, I have asked him to move to Gita because I am really revitalizing and trying to stand up and try to grow our aquaculture and our agriculture. And again, this falls in line to diverse industry. As you know, tourism is the one that we depend a lot on. It's a very fragile industry. And we need to make sure that we have other sources of economic industry in our community, so that if one fails, we can rely and continue on with the others. So my strategy is to put our resources into agriculture and aquaculture. And I have asked Bobby, because of his experience with fishery and so forth, to help out in the economic development portion of Gita. And also others, I think, that I have detailed. I don't remember all the names that you put forward, but the majority of them is retiring for very, I think, respectful and very heartening kinds of reasons. And I have to respect that.
And what about Leslie Travis?
But I just want to assure that, especially with Linda, when I first asked Linda to be part of our administration, she already was on the track of retiring. And she decided to delay her retirement to help out. And at this point, she wanted to retire, and it was time for her to. So what she has asked is to move on with her personal needs and her personal life. And so I was already expecting Linda, she wasn't going to give full. She did already warn me. But what I have done as a result of that is I have put in leaders and successive leaders to be able to continue on the mission and the responsibilities of public health. And so we continue on with the operations. There will be no interference or interruptions of the operations of public health. And that's very critical in times of our pandemic situation.
And Leslie Travis?
Yes, Leslie Travis will be coming on board with us on Monday.
Thank you, Thomas. Next is PDN Jasmine Stillweiss.
Afide, just going back to the quarantine measures, just to clarify, so for an example, if I'm coming from Tennessee and I'm a resident, but I'm transiting through Hawaii or Japan, Tennessee is a high risk state, so I will have to go through quarantine. Is that accurate?
Yes.
Okay. And it's also doesn't matter if you are a resident or not a resident.
We're not qualifying resident or non-resident. Jasmine, we feel that the focus should be on the risk. And that's why we are changing some of our protocol to address mitigating of the risk.
Got it. Going back to the airmen, you mentioned, and correct me if I'm wrong, so my understanding is that none of the positive civilian cases have been linked to the 35 positive airmen. Is that accurate?
That is correct. At this point in time, with the investigations that they have done, believe me, they have done a very meticulous investigation on this. It does not lead to any of the positive cases. But like I said, we are continuing with contact tracing and so forth. And I just want to say that, yes, it is alarming that we had one day a spike from, 1 to 35. And it is very concerning. In my discussions with Admiral Manoni and General Boswell, I have expressed my concern about it, and I have expressed the community's outrage, which is, I think, I would say, a very normal concern. And so I have asked them certain requirements, and they have adhered to those requirements. And first, they took all of the airmen back into their bases, and they are now doing very, very close supervision of those that are quarantining and those that are isolated. They're also, with my request, have prohibited active military to frequent the bars and the restaurants for the next, till July, I think, 2nd. And for me, that was a protective measures till we get the information and the data that we were going to get to have a better picture of the spread of the positive cases. So I want the public to know that in discussions and communications, and you saw the press conference by Admiral Manoni and also General Boswell, that they're very serious about it, and they are also doing their investigations. And they did also mention very clearly that these airmen are going to be made accountable. And if there's any violations, they will be disciplined based on the United States Military Justice Code. So this is not taken very lightly by the military, as we also, and I myself, have not taken it lightly at all. It's a very serious breach, I think, of quarantine procedures that, to me, could have endangered our community. And that's why we have been very closely communicating and very, very stringently looking at our contact tracing.
So if there are no, do we know yet if where the infection might have started with that particular cluster? Was it on Guam, or was it, were they infected outside Guam?
Jasmine, I am not informed by where the contact source. I think they're still investigating that.
Okay, thank you very much.
Thank you, Jasmine. Next is KOAM Nestor Lecanto.
Good afternoon, Governor. Good afternoon, Doc, and good afternoon, Lori. Just getting back to quarantine criteria, Doc. So you've identified quite a number of states that are now considered high risk. So how would we verify which state they're coming from? Would that be sort of a self-certification or an honor system? And also, would this apply to the military And is there a procedure in place where they would be required to advise public health whenever a deployment is sent to Anderson or to the Naval Base Guam, so that we can verify, we can trust and verify the personnel that are coming in?
Yes. So first of all, they are required to work with public health in particular, and to identify the origins for their of anyone who's traveling through that through their airspace and on their onto the base. But in terms of for the civilian community, they are required to fill out a health declaration form that includes also their places of travel and their origin. That's similar with their that's to be reviewed by customs as well. So yes, there is a component of trust that is with that, but then it is subject to investigation as the situation warrants overall. But yes, the question also had come up, and just because I'm sure somebody has this question, is what does it mean if I just transit it through a certain area? Like, let's say you come from, right now, New York is not a high risk area. And if you were to travel through and you were to lay over in California, that is listed in the high risk state. So as it is right now, we have decided to not include that in as part of the decision making into quarantine location, and that we're strictly looking at your area of origin.
But they did Lori, did they advise you of that previous, the 35 group? Were you did Anderson advise public health where these service members came from? Because from what we understand, you guys aren't even able to talk to them directly.
Can I just add to that, Nestor, and just to, again, clarify, clarify information out there. First of all, when the military arrive, they are required to fill out the same kind of documents as our civilian. And those documents are reviewed by Customs and Quarantine. We have Customs and Quarantine people up there at Anderson Air Force Base. So as they arrive, those papers are also reviewed, and because there may be some civilian or retirees arriving at the base. And so those papers are reviewed and they are acted on accordingly. And those documents are given to public health. So that's also the documented procedure that they have to monitor and follow them. When they do arrive, they are all required to also quarantine. The public health military follows our guidelines. And so they are all required to quarantine. General Boswell tells me that they are tested, and then I think the same 7-10 days in their quarantine, they're tested again. They are also monitored just like we do, and just like the sailors were. No one is coming out of the quarantine, or sorry, no one is out of the base. Right now, they are all in the base. As far as communication, I just want to, again, clear some of that information. Our public health and the military's public health are working very closely together. They share information, they communicate on a daily basis, they help each other with contact tracing. Where maybe it may seem like information isn't given is that they have access also. Our public health has been given access to interview those airmen. However, some of these airmen have lawyered up, and so they will not give us information. And so that's where I think the information came of not cooperating, Nestor. But and Lori can verify it because they do talk very closely. Additionally, Admiral Manoni and General Boswell and myself and the others communicate on a daily basis. As far as the airmen, what my understanding is that these mission people come and they are quarantined at the Guam Reef Hotel. And there's a wing there just for those individuals. And those individuals do not make any contact with any of the employees for the 14 days that they're there. Once they get and are released from that quarantine, then they can go to the main hotel and they can stay there, because I think they have a contract for that kind of living accommodation while they're here. And you heard, oh, there's a Reef employee there that was positive. In our contact tracing, and Chima's here, he can verify it, is that had no connection at all to any of the airmen. So I actually am glad that we have this press conference so the media can really get the correct information, because those kinds of information out there is not telling the true factual information, is causing anxiety for our people. And I don't want to say that, everything was done perfectly, because they weren't. There was violation of their quarantine orders. And like General Boswell said, once they investigate and get that verified, there will be consequences and they will be made accountable. Lori, you want to add anything? So
that's exactly what happened. And the one thing that is ongoing right now is our team and the military's team have been meeting constantly, right? And so there isn't any, it seems like everybody's been very transparent in all of this. Thank you.
Okay, Lori, if I could just ask you to get back to those 16 cases. You mentioned earlier that there was an increase in northern Guam, and that you, public health, will be increasing outreach there. Was that as a result of that 16 case cluster the other day? Is that where you saw the increase?
No, we've been monitoring the locations of every single positive case, and it's been continuously showing that a lot of the cases are coming from northern. And so we are now finished with the initial outreach that we were doing. And what we plan to do is continue the outreach for 3 more weeks. We're making a schedule. We're going to let the public know. And now we're going to concentrate on the northern side.
Yeah, just puzzled by the 16 case spike, because is that an anomaly or because that really had an impact on, for example, the pause in tourism reopening and the postponement of the island-wide cleanup?
The increase, I believe, is the community coming out and saying, I want to be tested. It was amazing when on Thursday in Jonia, we had a wraparound way in the beginning of the opening of that outreach. And we saw by 11 o'clock, we had to close, the gate, because there were 547 already that had come in for testing.
Thank you, Nestor.
Can I just
Yes,
add?
Governor.
And Nestor, this is what we want to happen. We want our community to come out and be tested. And like I said in my opening, we have a 7.4% penetration. That is pretty good penetration rate to try and get a good picture of our community spread. The concerning thing for me here, and I think public health is too, is the 16 isn't clusters. It didn't come from clusters. It's now telling us that these are all over the community. And so that's why it's very crucial that we continue with our testing and we continue with our contract tracing. And that is why I put a delay and a hold on what other restrictions we were planning to lift. And so we're not going to reverse any of the restrictions we have made. We are continuing with the activities because we want to make sure the activities going on so we'll know what exactly is happening out there in the community. So that's why Dr. Cabrera is really tracking mobility, because as people are more mobile and we see that we're getting more positives, then we're thinking, hey, they're mobile, but maybe they're not wearing their masks. And maybe they're not social distancing. You know, these are the kinds of things that the complexity of it and the investigative questioning is what we need to be addressing, so we can really make sure we isolate and we prevent and protect. So this is the strategy. It's coming to fruition, like we said, and we are prepared and we have planned for this.
Thank you, Governor. Guam Daily Post, Oyal Nirarekla.
Half a day, Governor.
Half a day.
Ma'am, you know, in light of the fact that, and kind of following on this line of conversation that you started with Nestor, in light of the fact that Mrs. DeNorsi did say that the patient number 1 at Reef Hotel was a local resident, meaning this was a local transmission of the virus, and that public health has said that the majority of local cases are asymptomatic. Additionally, Guam has recently been listed as having the highest increase per capita. Is there any consideration of not just ramping up local tests, as Ms. Duenas was talking about, but also requiring people to come in and get retested even if they've been tested already, and then requiring them to quarantine and isolate away from their families and population?
We're already requiring people to quarantine and isolate once we identify the cases, and we're requiring contact cases to quarantine also. And so that has not changed at all. As far as the data that you're referring to, you know, maybe Dr. Cabrera can talk to that. But as far as our testing and as far as our monitoring and as far as our contact tracing, again, we do have that capacity, and we are moving forward and implementing it.
Thank you, Governor. You know, the way you can pretty much sum this is that we have metrics to fairly determine when thresholds are being surpassed. Okay, and this is clearly the current situation. That's why part of the slides, that was the first part of making that case. Pausing any further relaxation of mitigation efforts is the first step. And so not going into PCOR 3, not reopening industry, that's the first step. But then the next part is to actually go back to our basics and what we knew was very, very effective even back in March. And that was stopping, you know, plugging the hole and making sure that new cases weren't coming in that were contributing to the spread that we're seeing right now. And so that's why now the focus is really on improving our quarantine efforts and making it more targeted toward the high-risk areas. You do that, and then we should start seeing at least this not starting to take off in a much more exponential fashion. Other than that, it's going back to the basics also of what we've been doing in terms of testing. Are we doing enough testing? So far we are. We're getting to the point where it's getting close that we're probably going to need to continue to do more. And in doing more, that has to be inclusive of a lot of other factors aside from what you had just mentioned. But yes, those are important. Some we have to consider retesting some, but the most part is to really just go back and understanding that you want to test those asymptomatic that are in particular household contacts of known positives, as an example. You do that, we identify more, and we kind of put out the fire, so to speak. So going back to, I forget, late May or so when we had the 11 cases in that one, what was really comforting for us at that time was that was one cluster. And so that was good. This is a very different situation right now because it's not a cluster. And so that's where we're taking, significant pause in this and really being sure that we identify. So if you're dealing with 15 cases, then and they're not related, then you have to look at that as 15 potential clusters. And so we're not saying that we're going to have to throw the hammer down again and go back to PCOR 1. We're not saying that at all. I want to be clear about that. But but because we're catching this early enough, and because we're not seeing the rise in hospitalizations, which we have to really emphasize that we have the time to really get this under control. And I think that's the big focus in this. And so having these positives is actually a very good thing, and in the setting of low hospitalizations, because it means it's working. The system is working, our process is working, and we have to double down on that.
Thank you, Doctor. And Governor, you know, in the last couple of weeks, there's been a series of resignations of key personnel to your administration. These are folks who had key responsibilities in terms of the response to the COVID-19 pandemic, not just talking about Linda DeNorsi, but also Tom Atta. We're talking about Hai Hyun, we're talking about Tony Babauta. You know, considering that this has been a very dynamic situation where the details have been sort of very intricate, as you guys have mentioned a number of times, are you concerned that people who have the most institutional knowledge of these details regarding the public health emergency are leaving, you know, and how are you ensuring that that knowledge is kept, is maintained, and you're able to continue to move forward?
I am not concerned that I'm losing institutional knowledge. Lori, for example, has more institutional knowledge than Linda. Lori started at public health way before Linda. In fact, Linda worked under Lori. So in the area of public health, I am very confident that the people that are there have the knowledge, the institutional knowledge, the scientific knowledge, the social knowledge, the investigative knowledge, the contact tracing knowledge. These people have worked with other diseases like tuberculosis, you know, dengue fever. And so far, we've been kept pretty healthy. And the same way with our coronavirus. I attribute our containment to coronavirus because of the expertise of our public health. And so as far as institutional knowledge, there are people within those agencies that have more institutional knowledge than the people that have decided to retire.
Thank you, Oya. PNC, Luella Licinio.
Hi. Given the spike in COVID-19 cases, Governor, is the
Luella,
government
can
still
you
considering?
fix your mic a little? You're a little muffled.
Oh, I see. Can you hear me now?
It's still a
Hello?
little. It's yeah, a little bit better.
Yes.
Thank you.
Okay. Sorry about that. Given the spike in COVID-19 cases, is the government still considering opening travel bubbles or tourism bubbles that are major tourism markets in Japan, Korea, and Taiwan?
Yeah. So, as you know, I have delayed and pushed back on the date. Of course, we're going to open tourism. When we do that is the question. But as you know, tourism is a major portion of our economy. Hundreds of thousands of jobs rely on the tourist industry, and I want to make sure that our people get back to working again. But more importantly, I want to make sure that that we are in a healthy and safe state to get back into our economy. The health of our economy is very important. The health of our economy needs to be addressed and attention be made. And so as far as the bubble with the tourism, of course, we are going to be opening that. I have just delayed it for now. I want to make sure that the numbers that we see in the next couple of weeks support the safety of our community in opening tourism. And you're right about a bubble. These Asian countries that we're looking at, these are very, very low risk countries. Japan has listed their public health emergency. South Korea, although South Korea can have some, areas also of increase, but overall South Korea and Taiwan. Taiwan is 0 actually in any of the scores and the numbers that they have. So they are very safe places of our market. And that is, I think, very good because it'll only, I think, give us more confidence of the safety of our community once we open up tourism.
Okay, thanks, Governor. And my follow-up question. There was, I guess, criticism from a local physician about Gulf Guam's quarantine regulations being unfair to local residents. Would you like to comment on that?
You know, I don't think it's unfair. Our Gov Guam regulations and quarantine is done, decided at the time, and its only agenda is to protect the people of Guam. It is not an injustice. It is not a basis of discrimination. Those comments, I think,
Mhm.
very insulting to the people at public health, to our community who have worked very hard to contain the virus, to our community who have worked very hard to protect themselves, their families, their dear loved ones. And so there was nothing in terms of what comments are being made. I think those are very uninformed comments.
Thank you, Governor.
Thank you, Luella. Mariana's Business Journal, Maureen Maritita.
Buenas, everybody.
Buenas.
I have a question for Dr. Cabrera. Good afternoon, Dr. Cabrera.
Good afternoon.
So in previous presentations, you've given us some projections to review, but and typically those have been tied to topics that might help the governor when deciding when to open tourism if they pan out. But there's no projections from you today on where the numbers will go.
Yeah, and so in order to project, you need what you need is a pretty reliable history first to make adequate trajectories. We're at the point right now where, because there's so many different mitigating factors, and because there's way beyond than what we've initially had when we were back in PCOR 1, that it's extremely difficult to have any reliability on any type of projection because the margin is so wide at that point. If we continue on this exact same pattern right now for maybe even the next week or so, then there might be a trajectory that could be produced that will be useful in some manner. But right now, that's not the case. So I rather not share that with the public because it may just cause more confusion and be not useful. So so that's why. But it is always considered, and but at this point, something like from University of Washington's projections and their trajectories, that is extremely sophisticated in what they are doing for the rest of the country, and so we don't have that type of capabilities for here. But they're also using a large pool of data to do that. But here in Guam, where the numbers are still relatively low, where one person can make 5 cases can make a big difference on certain things, we're just not able to do that.
Thank you, Dr. Cabrera. I have my second question is for the governor. So yesterday, after the announcement about tourism being on hold, the journal received some calls that the business community found out along with everybody else, the business groups that you have been in touch with throughout this process. And so I wanted to ask you 2 things in connection with that, because they made the point that that they were not consulted, and also aside from that, that they do need, they have been calling back staff and training new employees in industry-specific training, and so they felt in a very difficult situation. So could you comment on those 2 things, one communication and one the situation with their employees, please?
So the decision was made based on what was happening, and I needed to make a decision. And I did not run it by the business community. I felt that that was a decision based on what I thought needed to be done to protect our community. And so as governor, I made that decision. However, we're talking with the business community. I'm on constant communication with the business community. I do want to say, please continue on with your preparations, because this doesn't mean that we're not going to open tourism. It just means we're delayed. And the more I think we have time to prepare, and the more, they are training the staff, and they are employing them, which is absolutely what I want to happen. That just shows that we are, moving forward to the health of our economy. The business community also, Maureen, has told me that even if we have the date of July 1st, they probably won't see people coming till August or September, because remember, these countries that they're coming from are requiring these returning residents or returning tourists to their country to be quarantined. And as I understand it, in speaking with the Council General of Japan, that people will not travel if that is a requirement for them coming back to their country. So the tourism business, as you heard, have told us that even though we put July 1st as a date of opening, that we probably won't see these tourists come. So delay or not delay, we're not going to get the tourists. And even if we do, it's probably going to just trickle in. So but that doesn't mean that we are not going to open tourism. I think the people have to understand that delay is delay. It doesn't mean no opening. We are going to open it. Rest assured we are. But we also want to do so in a very safe environment. Because the tourists also, Maureen, don't want to come to a place where they feel is not safe, or to a place where there's an increase of positive cases. They're tracking us too. So I think doing this just says to them that we're really being very cautious. We're being very safe. We're being very judicious in our thinking in terms of mitigating risk and protecting our community.
Okay, thank you, Governor.
Thank you, Maureen.
Thank you, Maureen.
Governor, would you like to make some closing remarks?
I just wanted to thank Dr. Cabrera and also Lori Duenas for being part of this press conference. I think we have given the media and hopefully the community more factual information and more correct information and clearer information that they can use to help allay some of their fears about our community and our containment of the coronavirus. And again, I know this is going to sound like a broken machine, but please wear your mask, social distance. I have been in places that people aren't complying to social distancing, and that is a very concerning, because remember, now we are seeing community spread of the virus out there and not so much clusters. So please help us. Please help our island. Please help us be safe and comply and adhere. Do not be complacent. The virus is still very active in our community. Let's all do this together. Let's do it with great support of each other. And again, I just want to thank you for your patience. Thank you for your support, and appreciate the struggles that you are going through in this time of crisis. Thank you, and Sejus Masi.